more than what it was possibly in 17th or 18th century. So we should have more potentiality in our treatment protocols, safe delivery system, and also it is more effective to the patient. So on these grounds, let us try to see what is my view of understanding a particular set of drugs which we are using in our clinical practice. The very first thing is sadhyeshu beshajam sarvamiritam tattva vedina asadhyeshvapi datavya rasota shreshta mukshati. Among the science of Ayurveda, you find many places the references stating like, this is asadhya vyadhi, don't treat or you might lose your fame. It's a kritsura sadhya. It's better you ask him to quit. Rasa Shastra is one such a science of Ayurveda where he tells, even though it is asadhya or kritsura sadhya, you should treat him. And it is possible because you are using the most potencified drugs called as Rasa Aushadhis. So you can definitely treat a very chronic disorder, grave disorders, might be the Sannipataja conditions, or might be the conditions where it is related to the Bahudosha Avastha. And try to treat the patient as best and safely as possible. This is the reason why it is considered, and you have many of the ganas explained. Every one of us remember, there is something called as Kushtagna Gana, Jwaragna Gana, Medhya Gana. You have Dashaimanis in that protocol as well, like Acharya Charaka and Sushruta has explained. Rasa Shastra is the only textbook where he speaks about Mrityugna Gana. This is a very, very atypical presentation where you have Mrityu Haradravyas. When you have this Mrityu Haradravyas, it is something like where you are tackling the disorders where the patient can die. It is intensive care patients. Where you have the intensive care patients, you are supposed to treat the person with a very potent drug like that of a Mrityugna Gana. Let us try to see what are these things. When I have a patient right in front of me, you might say, sir, I'm not really well versed in analyzing so many factors of Ayurveda, which has been explained. I'm quite an enthusiastic person to the Ayurveda. What is that I need to have as a basic protocol? The second question is, people might ask, sir, I am from Ayurveda. I do believe in the science a lot, but I want to start with some of the Rasa Aushadhis. So what is the basic requirement I need to keep in my clinical practice? This is the second question. The third question is, I have a patient who is unconscious in the intensive care. He is not able to open his mouth and explain you what has happened to him. Then what is the drug of choice I need to give to the patient? In all these things, we are having a general protocol which has been explained in Rasakamadhenu, where he explains about Arogyam Bhaskaradiccheta. When you have a patient coming to your clinic where he is always ill with some or the other diseases, this is very common nowadays. Always the patient comes to you with some or the other complaint. When you have this Arogya Rasa, Bhaskaradiccheta, Bhaskara is a synonym of Tamra. When you have a patient who is on recurrent disorders, you are supposed to give him Tamra Basma or any derivative of Tamra. You have a patient wherein is always suffering with some or the other disorders, you are supposed to treat him with Tamra Basma or derivatives of Tamra. You can give Tamra Parpati, Tamra Sindhuram, Tamra Garba Potali, that will come eventually. But presently try to keep Tamra at your clinic. He is a very good Vaidya, he is called as a Rasa Vaidya, in case very good Rasa Vaidya. They are very, very potent drugs where you can handle them in any way you would like to, and they give a huge benefits to your patients. The second thing is Soma Dhatu Samruddhitam. Is a synonym of Rajata. So you have any patient with any of the Kshaya of the Dhatus, then Rajata to be planned. Whenever you have the patient with any of the Kshayas, Kshaya of Rasa Dhatu, Rakta, Mamsa, anything like that, in those conditions we are supposed to plan with Rajata. Any of the Rajata preparations, but the chief drug of acting is Rajata. Roga Prashantaye Sevya Deva Deveshwara Sada. When you have this particular person where the person is not at all coming out of the disease, say for example, cancers. You have some conditions wherein the person is almost not coming outside, is consistently troubled by the disease for a very long time. He is not at all coming out. He always says, sir, I take some treatments, I'm okay to some extent, but again still the disease continues. I don't have a full stop. So you have this set of patients So when you have that, Roga Prashante Seve, Deve Deveshwara, Deva Deveshwara is a synonym of Swarna. So in those conditions where you want to drag the patient out of a particular illness where he is suffering since long, or where you don't want your patient to land up into such disorders, we give Swarna. Any of the gold preparations, but Swarna is the chief ingredient. So when you have the Swarna Basma in your hand, you can pull the patient out of any of the chronicity of the disorders, or any disorders where he is suffering to the extent possible. Nagesho Nagabalado. When you have the Bala Rasa, the patient says, I'm always weak. I don't have strength in my hands and legs. My body is so debilitated. In those conditions, where you have this in so many conditions, including simple diabetes, metabolic disorders like thyroid or anything like that, or you have cachexia, where you have malignancy conditions. So most of these conditions, autoimmune conditions, where you have Bala Rasa. Unfortunate part is, after the COVID crisis, we find this Lakshana at a significant level, even in the post-COVID period now. We find so many patients right from the period of COVID, I find always I'm little bit down. My energy levels are gone down. So when you have these particular complaints in your patients, then you're supposed to give him Naga Basma or derivatives of Naga. When you give Naga, the patient is out of that Bala Rasa, is out of that particular illness. The next thing is Yamadhyamam Bhayam Nahi. So in case if you have Loha Basma with you, then what happens? The patient's Ayu is increased. You have a set of patients, by the time they listen to the diagnosis, they say, okay, I'm died, finished. My life is khatam. They imagine themselves there at the entry of the burial grounds. There are some disorders of these kinds. Or when you find Ayu Rasa, the person doesn't have expectations, or the doctor also doesn't have expectation that the patient might survive. In those critical conditions, Loha Basma. Loha Basma is to be prescribed to the person wherein he is out of this particular Ayu Rasa. The next thing is to increase the Shukra Dhatu, then the Vanga is to be given. Shukra is a synonym of Vanga. So Shukra, in the sense, don't take it as an aphrodisiac alone. It is having lots of clinical functions, including something like wherein the patient is having a Pratilomakshaya Janya Vyadis. You have Anulomakshaya and Pratilomakshayas, wherein one dhatu is depleting another dhatu, which is super influencing another dhatu. In all these clinical conditions, try to treat him with Vanga. When you have Vanga Basma in your clinic or derivatives of Vanga with you, then he is out of this Shayas of the successive dhatus, which is tend to happening. So you have hardly the 6 drugs in your clinic. If you have the 6 drugs, it's enough for your clinical practice. I'm not saying the rest of the drugs are of no use. Definitely they do have their own thing. But as an initial protocol where you want to start up your clinic or where you want to introduce Rasa Shastra into your clinical practice, these are few very commonly seen clinical conditions in the patients wherein they might help you to an extensive way and make you to the utmost benefit. The next thing is Rasa Shastra, the science of toxins, advantages of toxicological practice. People always claim about this. You are using Rasaushadis, heavy metal toxicity. They are being more than the required quantities in the serum levels. Then how is it we are supposed to handle those conditions, because we are super influenced reading those modern articles? Heavy metal toxicity, they have accumulated in liver, in kidneys, elsewhere in the body. Why should we need Rasaushadis? What is the need of Rasaushadis? So here normally what happens, you have a simple knife in your clinic, in your kitchens. It might injure you, it might hurt you, or you can kill a person with a knife. It doesn't mean that you throw it outside the home. It is absolutely useful. Walking across the road, you might be hit by a bus or a lorry, and it might be casualty. Will you avoid going into the roads?